Can a herniated disc heal itself? This is a great question, and I'm going to read to you what kind of answers you get when you Google search this. And so the answer you get is usually a herniated disc will heal on its own over time. Be patient and keep following your treatment plan. If your symptoms don't get better in a few months, you may want to talk to your doctor about surgery. And so what usually is going on in the body when you have a disc herniation is what happens is there's an injury that occurs, correct? And your body has a way of trying to heal itself. So let's go over this a little bit first. So one of the things we're going to do is we're going to take our little spine friend here. And what you're looking at here, this is the pelvis or the hips. This is the low back. You have your ribs, so up above is your head, below is your feet. We're going to zoom in on this little area here. This little red dot that you see here is actually a disc herniation. And so we're going to take it and we're going to zoom in on that specific area there, okay? And so I'm going to take this model and I'm actually going to flip it around. So here's the back side of the body. Here's the front side of the body. You have your two vertebrae above and below. This is your disc. These are your spinal nerves that come out here. And so what happens is when we bend over to tie our shoes, when we bend over to brush our teeth, when we're doing dishes, when we're lifting, we're standing up from a seated position, all of these things have flexion in common. Not that these things are bad for you, but over time, if we're not doing them properly, they can cause injury. So I'm going to show you how that injury occurs in your spine here. And so when we cause flexion and compression of the discs, over time, what you'll see here is that the disc material will start to migrate backwards and it starts to compress on that nerve there. And when compression of the nerve occurs, you get pain, you sometimes get numbness and tingling, and this injury that's occurring here causes your muscles to spasm up and to get stiff and to cramp, and that's your body's way of protecting itself. And so just like when you get a cut on your skin, this is kind of like a cut in your disc. And your body has its own way of healing this. It does that through sending blood and sending inflammation into the area. This is all normal for the body to cause healing. And so does a disc herniation heal on its own? It can. It absolutely can, depending on the person, depending on the severity, depending on your lifestyle, depending on if you keep causing injury over and over and over again. That's the key here. And so one of the things mentioned in Google is you need to keep following your treatment plan. If you don't have a treatment plan, you're going to keep getting injured. And so here at Performance Place, what we do is we try to figure out through history and through examination what is causing your pain and what types of things do you need to stay away from for the time being to prevent injury from reoccurring. And then what can we do over time to prevent you from keep re-injuring yourself. And so a lot of times what we see here in office is as we go through flexion and it's causing the person's pain, sometimes all we have to do is just do the opposite motion for a little bit of time and stay away from the motions that are causing the pain in the first place, and people tend to get better. This will reduce pain, absolutely, but this does not fix what is causing the pain in the first place. And so we can go over this virtually with what we're going through right now with the COVID-19 virus going around. We still want to be able to help you. We don't have to see you here in office for you to get better. We can talk to you over video, and if this is something that you're interested in, please give us a call here. We're located here at Performance Place Sports Care in Huntington Beach, California, and we are looking forward to helping you, whether that means that you're here in the office or you're at home over a video call. We don't need to put our hands on you to help you through this.